Hello, my name is Hannah Grumke, and the study I decided to go with for this project was pregnancy and birth outcomes after SARS-CoV vaccination in pregnancy. So there wasn't a hypothesis or a null hypothesis stated in the article, but the purpose of the study was to determine the efficacy and safety of the COVID-19 vaccines in pregnant patients and if it affected birth outcomes. The reason that they did this was because there had not been many studies done for pregnant people at this time. I created my own null hypothesis, which is COVID-19 vaccinations during pregnancy has no effect on the likelihood of infection during pregnancy and causes adverse pregnancy outcomes compared to those who did not vaccinate during pregnancy. The sampling method that was used was a cluster sample. They used a comprehensive population-level sampling by using the vaccine registry data from multiple hospitals across 2 states, which were Minnesota and Wisconsin, along with the pregnancy outcomes of these people. They used regressive data from the first 4 months that the COVID-19 vaccinations were available. I think that the sampling made sense because they were using what they had at the time. However, there weren't many people that actually were vaccinated in the study compared to the rest, so I wish it would have been a bigger sample. And the vaccination sample meant being vaccinated at any time during pregnancy, so it didn't discriminate first trimester, second, or third, although most, I think, were third trimester. All of the hospitals were part of the Mayo Clinic database, and this was during the first 4 months of the vaccine rollout, so it may have affected who had access to the vaccine and who didn't. So the results of this study, so there was 2,002 people total in the delivery cohort that they looked at. 140 of those people were vaccinated, and 1,862 people weren't vaccinated. So 212 people total out of the 2,002 experienced COVID-19 during pregnancy. So 2 people out of 140 that were vaccinated got COVID-19, which is 1.4%. And then 210 people out of the other 1,862 people that were unvaccinated got COVID-19, which was 11.3%. And the p-value for this data is less than 0.001, so it seemed to be statistically significant based on the numbers that they were using. So in this study, anything under 0.05 they considered statistically significant. So another one of the results were they used the Adverse Outcomes Index, or AOI. So this was anything. They were categorized but as one whole thing, but it included maternal death during hospitalization, intrapartum neonatal death within 7 days of birth with a birth weight of less than or equal to 2,500 grams and less than or equal to 37 weeks of gestation. 3, hypoxic ischemic encephalopathy, uterine rupture, unplanned maternal ICU admission, returning to the operating room within 72 hours of delivery, postpartum hemorrhage with blood transfusion, 3rd or 4th degree laceration, 5-minute APGAR score of less than 7 with a birth weight of less than or equal to 2,500 grams and less than or equal to 37 weeks gestation. And lastly, admission to the neonatal ICU within 1 day of birth for greater than 1 day with a birth weight of bigger than or equal to 2,500 and bigger than or equal to 37 weeks and neonatal birth trauma. So these are a lot of variables that are involved in the birth outcomes, as you can see. But the study found, in general, no significant difference in adverse outcomes and maternal or fetal complications of vaccinated versus unvaccinated people during childbirth. So 7 out of the 140 unvaccinated, and 91 out of the 1,862, which is about equal to 5%. The P value for this is 0.95, which means that it's not statistically significant. So it's showing that this could just be by chance that the different groups experience different complications. I also wanted to note, it was interesting, so the socio-demographic factors that ended up being of the people who were vaccinated included older maternal age at delivery, higher level of maternal education, use of infertility treatment for the first pregnancy, and a lower gravidity. So if it was their first child, with a less than 0.05, which means that it was statistically significant. And then factors negatively associated with vaccination. So it means a lot of people that weren't vaccinated were non-white, Hispanic ethnicity, current smoking status, current illicit drug use, higher gravidity, and a higher pre-pregnancy BMI. So again, this is the vaccinated versus non-vaccinated. I wonder if these criteria and descriptions of these people may have affected their birth outcomes or their likely chance of getting COVID during pregnancy, regardless of getting vaccinated or not getting vaccinated. So the primary outcome was the adverse outcome index. They used a two-sided chi-square test. A 95% confidence interval was used. The p-values were two-sided, and the p-values under 0.05 were considered statistically significant. The study was designed with an 80% power, with a type 1 error rate of 0.05 to detect a difference in adverse outcome index of 4.9%. versus 11.5% between patients with and without COVID-19 vaccination during pregnancy, based on the 1,862 and the 140 patients in the two groups. So their conclusion stated, in this birth cohort, vaccinated pregnant women were less likely than unvaccinated pregnant patients to experience COVID-19 infection, and COVID-19 vaccination during pregnancy was not associated with increased pregnancy or delivery complications. The cohort was skewed towards late pregnancy vaccination, and thus findings may not be generalizable to vaccination during early pregnancy. So this is the conclusion stated in the article. Personally, I would have liked to see a larger sample size with the goal of including more numbers of folks that were vaccinated, so the comparison of data could be more accurate. I think that this is a solid study that I could potentially show to clients, but I wouldn't necessarily change my practice around it. And I also think that there are so many other variables that affect the outcome of this study. Like, were the people masking? Did they have more or less exposure? Were they infected with COVID-19 prior to the study or prior to pregnancy, therefore possibly immunizing them? Where were they birthing? We also saw like the smoking versus not smoking status and things like that. All of those things affect birth outcomes, so it's really hard to pinpoint it specifically to the vaccination versus not with such a small sample group. They also only used data from the Mayo Clinic Health System. Within the samples, there were factors associated, and again, like I mentioned, those were older age, higher level of maternal education, non-smoker. Could any of those factors have affected as well? And then we also want to take into account that the study was done during the rollout of the vaccinations in the first 4 months that they were available. So who had access and who did not, all those types of things. So I think this study could be helpful if it was redone now with a bigger sample group and then getting more specific on the adverse outcomes, what those were, based on those people in each category. And then first trimester vaccination, second, third, because this study was just anybody who was vaccinated at any time, whether it was 1 dose, 3 doses, whatever. So there's a lot more specifics that need to be had to show efficacy in a study like this, but I think it is a good start as far as working on something that there wasn't a lot of information about at the time. So thank you for listening. I hope this was helpful. Here is my article, and I look forward to answering your questions.